Now, our patient is coming from Canada. He is coming here for a Rezum procedure. I think he is also having some, he's young and his prostate is not too big. So there's two options. He may have some prostatitis or he may have bladder neck stricture. So I'm trying to go in. I'm inside the bladder now. Yeah, bladder neck is not very tight. It's good. And oh, infection is coming out already. So I will do the prostate massage first. It has more than normal residual urine. Look at this yellowish color inside. This means residual urine. And I am doing the cystoscopy right now. And you see the floating particles. They are really related to infection. So I will drain the infection first to increase the effect of the hot steam. And then we'll give the steam inside. Bladder seems normal. There's no tumor, no other things. There are slight trabeculations, not too much. And now I will look into prostate. Okay, see this inflammation. I am washing it and it's coming again. Washing. And when I squeeze the prostate, the inflammation is coming. Washing it, squeezing. See this. Yeah, I am pressing the prostate. Look this. So I think it is a good idea to clean this infection, to drain this fluid first, because the steam, hot steam, will be absorbed and cooled down with this inflammatory fluid, which I don't want, because it will decrease the effect of the steam. Okay, look at this inflammation. It's coming from these parts of the prostate. You see? So normally, with resectoscope, the instrument that we do the TURP or Holland, the irrigation is better and I can show them better, but also in this case we are lucky to see these inflammations. Normally Rezum instrument is tiny and you can see the very nice STRP. So I want to drain all of them. It's really sometimes difficult, but I have to spare some time here. He's coming from Canada just for this. It's not a very big prostate, so he's having difficulty both in doing urine and because of this inflammation he's having pain. Normally we do prostate massage for the treatment of infections, and the fluids are coming in the massage are those. Yeah, it's really tiring. But I don't want to leave too much infection behind. Look at this side. When I drain it, it begins to come more and more. So I want to be really patient and finish it completely. Look at this. I don't want to do the Rezum with this inflammation inside the prostate.
Are
really need my assistant, Ali. It's okay, really, Ali, come with this. Okay, now he is doing, but it's not easy to keep the vision. Okay, now it's about to finish. I think we drained a really significant amount of fluid from this. Okay, for left side, I'm satisfied. Look again to right side. I don't want to leave this. Yeah, okay. And every time. Oh. Yeah, I think it must be enough. Okay, so pause. Okay, so it makes a little bloody making this massage. It makes some hemorrhage here, so it's a little more difficult to identify the structures. So this is very montanum, where it is the inflammation was coming out, and this bleeding will stop here, and here the bladder neck. It's not a very long distance. This is half a centimeter here, 1 centimeter, and 1.5. Yeah, less than 2 centimeter, 1.5 to 2. I will calculate again. This is very montanum. We have the bleeding here. It will stop soon. This is because of the massage. This is very montanum. This is half centimeter, 1.5. Okay, so theoretically it's enough to make one steam to each side and one steam to middle lobe. Let me see what will I do. Okay, this is the left lobe. I can do it here. Just this is half centimeter, this is 1 centimeter. And yeah, I am putting it here, giving the steam. 9 seconds, we sent the steam inside. Let's see what happened. Yeah, there is some opening now. And some whitish tissues here. Let's do one to this side. We can't do just the bladder neck. Half centimeter, 1 centimeter. Send the needle. Send the steam. Out. Yeah, now instantly it seems to me at least a little larger, better, and this bladder neck is forcing me in right now, so I will put a needle to here, the bladder neck. Yeah, a little oblique. Yeah, this one. Okay, this part is bladder neck. Now it's easy to go in, to go out. Still there's inflammation, most of them drained. I will do one more here. The left side was more affected, I think. Yeah, nice. Look, now vision is better. Yeah, I don't think there will be. You see, these tissues are affected with steam, with hot steam. Yeah, less is better, they say. And 2 to left side, 1 to right, 1 to bladder neck. And let's look at the upper part. Yeah, this upper part seems thinner. Yes, I think it will be done. Yeah, that is really bladder neck obstruction, so I'm thinking about doing one other to this part. Yeah. Yeah, okay, I am more satisfied now. Yes, I hope this will work for my dear friend from Canada. Yeah, it's now better. I can feel it going inside, coming out. It's better now. Okay, and let me see one more time the urethra. Yeah, everything is better now. Okay, now. Okay, this was a 53-year-old friend from Canada, and he came here saying that he has difficulty in urination, he has difficulty in sexual life, and he has some constant pain. So he know that he has previous prostatitis diagnosis and he has now BPH symptoms. Altogether, we want to get rid of all of these. Rezum therapy, I can't guarantee the Rezum treatment for prostatitis. Its aim is to open the urethra channel wider, and it's done for obstruction. So we wanted to get rid of this prostatitis with Rezum too, but it's not a guarantee. But for obstruction, I am sure it will be wide open. We can't use too much steam in that cases, because if for a small prostate we give a lot of steam, this may cause retrograde ejaculation. Normally retrograde ejaculation ratio is very low in Rezum, but if for a small prostate we give too much steam, there's a risk for retrograde ejaculation too. For his sexual desire, his testosterone levels were decreasing, and he has a huge varicocele too. So we also operated his varicocele. Although he's 53 years of age, he has a huge varicocele, and in 15 minutes we did a varicocele surgery for him. Now we are expecting the responses. We will do the follow-up, and he will stay in Turkey for a week for the catheter removal. This is the weakest point of prostate operations. You have to spend here after the procedure at least a week. But it's possible, it's doable. He came from Canada, he will wait for 1 week, then we will take the catheter and send him back.